Okay, good afternoon, doctors. I just need one of my staff to actually just let me know that you can hear and see the presentation. Everything's good. We're good. Okay, great. Thank you very much. Good. All right. Good afternoon, doctors. Welcome to today's program. The biggest breakthrough in X-ray science for spinal ligament specialists just occurred in June of 2018. It's nothing new for us here at Spinal Kinetics, but it's new for the field. And so I'm really, really excited to be presenting this to you this morning because this is some pretty sophisticated stuff. Spinal ligament injury specialists and people that specialize, doctors that specialize in this condition now are seriously starting to take off in the market, and there's so much that you can do with it, so much growth potential with it. So let me start by just showing you a couple things. This is a new discovery that's huge for the spinal injury market. It's absolutely huge. Now, it's huge also for the chronic pain market. All right, so what I'm going to be sharing with you is for both. Today, spinal soft tissue injuries are the number one cause. They're the number one physical cause of pain and disability in the world today. And the reason why they are the number one cause is because there's such poor diagnostic procedures that are not standardized. Of course, this doesn't have to be our tomorrow. Now, a lot of doctors in the field today do not know how to diagnose these, do not know how to treat them. So it's a niche industry within an industry. It really is. And it's probably one of the most exciting fields there is in healthcare today. Now, who am I? So for a lot of you doctors that are signing on today, you don't even know who I am. You've never heard of me. One of the top spinal ligament injury trainers in the country. I was a treating doctor of chiropractic for over 17 years. I've developed 2 national spinal ligament testing companies. You're on today with Spinal Kinetics, which is the only national medical spinal ligament testing company in the country. And we're very proud of what we're doing in the country today with spinal ligament injuries and spinal ligament injury diagnosis. I developed and expanded the technology used by medical radiologists for what's called CRMA testing. By the way, CRMA is the trademark of Spinal Kinetics. That's what we call this specified procedure and the software that we run to do it. I've trained more radiologists in the country than probably anyone on doing these procedures. I've done more webinars. I've delivered insurance programs, defense attorney programs, insurance defense programs. I've basically developed the top now doctors training program specifically for spinal ligament injuries, and also the top attorney training program for spinal ligament injuries in the country. So spinal ligament injuries are important because if we take a look at this slide right here, and I apologize, it's going to bounce around just a little bit because of my mouse. These are the main symptoms of spinal ligament injury. I have presented this so many times, so many times. So you're going to look at these symptoms. You're going to say these are the most of the symptoms that come into a chiropractor's office or a physical therapist's office. These are the main symptoms, right? So what we really have to understand is we have to understand diagnosis. We have to get back to diagnosis, and that's what Spinal Kinetics does. That's what we help elevate doctors to do, because diagnosis means that you're going to identify the nature of the problem by examining the symptoms. Now, nature means a physical phenomenon. And it means basic or inherent features of something, right? That's what nature means. It's a physical thing that you see with this thing. So if you have this symptom, there's a physical thing that you see with this thing. Inherent means that it exists in someone or something as a permanent or inseparable element. So if we kind of look at this is going to make this really easy for you. If we take a look at the next thing, inherent means inseparable, permanent or inseparable element. So if we look at a leg fracture, inherent in a leg fracture is you have to see a displaced bone on x-ray. You can't really have a leg fracture. You could have a very mild stress fracture that may not show up on x-ray, may need a CT or a specialized study, but inherent in a leg fracture is a displacement on x-ray. Now, if we look at a spinal sprain, what is inherent? This is where so many doctors miss the boat. So many doctors miss the boat today, and there are so many patients that are suffering as a result of it. They've been to chiropractors, they've been to physical therapists, they've been to medical doctors, they've been to orthopedists, and they've not been to one doctor that understands the condition that they have, which is a ligament condition. And they've not been to one doctor that can actually even diagnose it. So what is inseparable or what is inherent in a spinal sprain? Well, it's very easy. What's inseparable is joint motion, excessive joint motion. That's like the fracture, the bone displacement for a fracture. If you're going to have a sprain, you have displacements of the motion units, or you can have disc herniation. There's two spinal sprain conditions in the spine: disc herniation and excessive motion. That's what it looks like. That's what this thing looks like. Now, there's a thing called an imaging biomarker. An imaging biomarker in medicine, an imaging biomarker is a feature of an image relevant to a patient's diagnosis, right? So if you diagnose a patient with fracture, what do you got to have in imaging? You got to have a fracture. If you're going to diagnose that the person has a ligament injury to the spine or any other joint, but it's easiest in the spine, what do you have to have? Excessive motion or disc herniation? What other kind of ligament injury is there? So at Spinal Kinetics, we're a small company and we're making a huge difference in the spinal injury market. We're making it a reality that spinal ligament injuries can be accurately assessed and diagnosed in a very systematic way so that these injuries are no longer the #1 cause of pain and disability. We know that we're leading the way to a future that produces far better patient results and at significantly lesser costs. We're very proud of that. Again, doctors, we are the only national medical company in the country. We're the only one. Now, you're going to see people buy little softwares or people do things to try to do this themselves, and that's fine. That's fine, but it's not where we're at. We're at increasing the professionalism of the providers that utilize our service. That's where we're at. We've also produced science. We've contributed. So we're the only company. I don't care if you're using a small local company or you're using somebody else. We've actually produced science. We published research that showed, in this case, we took 100 different sets of spinal stress x-rays, 29 of which had severe ligament damage on them, sent them out to a board-certified radiologist, and how many do you think the board-certified radiologist picked up? 0. That's what we published. Why? Because it's not a sight phenomenon. It's a measured phenomenon. We've also published science that says, hey, opinion papers that say, is a simple sprain from whiplash injury really that simple? No. Spinal pain, maybe it's not all in your head. No, you're not malingering. Your patients are not malingering. All right, now we've also elevated. So here is a big problem in the injury market and in any market that is treating chronic pain in the spine. This is why chronic pain in the spine is so out of control right now, because there's so few doctors that understand this, right? If this person had a leg injury, would any sane doctor say, well, what's his problem? He has a leg sprain, or he has a lower extremity sprain? No, no one would say that. Why? Well, because there's 30 different joints in the leg, right? So the first question anybody would have if you said, well, they got a leg sprain or an extremity sprain is, where is the sprain? What joints are affected? Right? Now, here's the problem. In chiropractic, in physical therapy, and in medicine right now, these supposed specialists says, oh, you got a cervical sprain. How is that different than somebody saying, you've got a leg sprain? All right? There are 31 different joints in the cervical spine. So it's time to start giving the spine its credibility in how sophisticated it is. So we look at this and we say, gosh, where is the cervical sprain? Where's the ligament problem? It's very easy. It's at C2, C3. That's the area it's at. You look at it and you say, if it's going to be in that area, then chances are good you're also going to see a displacement at C1 and C2 if you'll image for it. In that same category with this right here, we would not expect to see this. We would not expect to see, we would not, let's get it, I'll get it. We would not expect to see this right here. Right, but these are sophisticated doctors that are understanding this now, and this is why I put this information out to you through Spinal Kinetics, right? Because Spinal Kinetics is a ligament testing company, so it gives me the chance to do webinars for Spinal Kinetics to educate the doctors on just how sophisticated the doctors are that use us, that regularly use us. So if we take a look, it's the same. If I look at that and say, well, where would the sprain be? It's obviously it's at the C6, C7 area. And that's how easy it is to use this. If I looked at this one, this is all, everything's within normal. So if there is a sprain or a ligament condition here, it's mild at best. Now, the same thing can occur for the lumbar spine. It's absolutely no different. You look at this image and you say, okay, where is the problem with the lumbar spine in this image? Well, the major problem is at L5. Now, if we look in extension, we can also see there's problems at 2, 3, and 4, but the major problem is at L5. As a matter of fact, we would even consider the fact that there may be a disc herniation. And by the way, this right here, this finding that you see right here in the lumbar spine is a rateable impairment under the AMA guides. So it's very significant. So let's look at the X-ray science update, June of this year. Finally, spinal kinetics is getting validation. Now, in order for me to share this with you, I need to clear a couple things, and I apologize, this slide may be just a tad blurry. I might have blew up the image just a little bit. I apologize. In medical diagnosis, test sensitivity is the ability of a test to correctly identify the disease, whereas specificity is the ability of the test to correctly identify those without the condition. All right, sensitivity, those with; specificity, those without. So here is the breakthrough in June of this year. Now I'm just going to read from this line right here. In the results of this study, so this is called predictability and severity of disc degeneration and disc protrusions using horizontal displacement of cervical dynamic radiographs. A retrospective comparison study with MRI, published in June of this year. Now, I have been saying for years, I've been teaching through spinal kinetics, through the ligament testing company that I had before that, and through my online training courses, that basically when you have displacements, you have a high chance of disc herniation at these areas unless they're in the upper cervical. So let's take a look at this. What this says right here, in the results of this study, the extension radiograph at 5 and 6 had the highest sensitivity. That means 93% of the time it predicted that there was a disc herniation, and the highest specificity at 100%, it predicted there wasn't. So if there was no horizontal displacement or very little, it predicted that there wasn't a disc herniation there. If there was horizontal displacement, it predicted that there was a disc herniation there. And it said it was followed second by the C4, C5 area, 77.28 specificity or sensitivity, I'm sorry, and 92% specificity. Now, I'm not going to read you this whole thing, and I'm not going to dissect this because it also gives you the understanding of how it predicts disc degeneration and disc degeneration. But that's more advanced because anybody that understands spinal instability knows that the advanced things that you see on X-ray as a result of it are spinal degeneration. So let's break this down a little bit. What this study said is that if we see horizontal displacements, now, I don't want you to get the idea that just because you see these, that's all you have to do. There's too much more to this. This has already been too simplified and too dummied down by too many doctors, quite frankly. Okay, what you want to understand is that there's some sophistication to this, right? This doesn't even go into the fact of abnormal angular findings. So, but what it says is that if you have this, you have a high probability of this. So let's take a look at this once. Here's a test from Spinal Kinetics. Person's in an auto accident, person's in an injury, and what do they have? C5, C6 is pretty significant here. Now, is it rateable? No, there's no rateable finding here under the Croft treatment guidelines. This is a grade 2 sprain right now on your X-ray. If it had a disc herniation, it would become a grade 3 sprain. right? So C5, C6, highest specificity, 77.28%. So 77% of the time, if you went and did an MRI, you're going to see a disc herniation. This is beautiful, beautiful stuff. Now, how about this one? Same thing. Same thing. You know, you look at this, you look at the displacements, and you go, okay, you're going to see that in this category, you're looking at the probable disc herniation. Let's look at another one. All right, here's another one. Now, in this case, we only see up to C5. Why? Well, because when the provider took the X-ray, they cut off C7, and we could only start with C6. But in this study, we take a look and we say, okay, at the C4 area, 2, 3, 4, at the C4 area, this is highly predictive of a disc herniation. Now, why wouldn't the rest of this spine extend over the top of that disc herniation? Would that explain why you're getting flexion and a lack of extension into this view when it's the upper cervical spine is trying to extend right into a disc herniation? Of course it would explain it. Now, what I'm showing you, this, doctors, this isn't stuff that you just keep in your mind and you go, wow, it's good, I know that. And you go back to your practice, your Thursday practice, and go, wonder why this patient of mine is not improving, or why they're not improving as quickly, or why they've had this condition for so long, or gosh, if they have an injury and I'm just calling it a cervical sprain, what do they really have? Because what I'm showing you here is so sophisticated and so simple that it makes you that understand it a spinal ligament injury expert, a real spinal injury expert. You know, I have doctors that call us all the time in Spinal Kinetics and say, well, gosh, the study came back. In this case, this study is not ratable. The study came back with, you know, some bad findings, grade 2 findings, grade 2 sprain findings, but it's not ratable. What do I do? Well, you look at this now. You say, okay, great. So yeah, it doesn't qualify for a category 4, but if you've got a disc herniation, it qualifies for a category 3. And now you have the rationale for sending out for the MRI, and you got the science behind it. This is beautiful, beautiful stuff. Now, in this study, would we expect to find a disc herniation associated with this study? No. But is this a ratable finding? Yes, this is a severe upper cervical finding. Severe. We don't see a lot of disc herniations up in that area. But it doesn't mean, this is why the testing is so important, and understanding the testing is so important. How about this area here? How about this profile? Well, absolutely. That's a ratable ligament injury right now. And we also could go, gosh, could there be a disc herniation with this? Yes, there could be. Yes, there could be. And the more you do of these tests and the more you start to clinically correlate, and doctors, I really don't consider anyone that's done less than like 100 of these studies to be mildly proficient in it. Like, we have doctors all the time that'll send in 1 study, 2 studies, 3 studies. We never see them again. Those are dabblers. Those are complete dabblers. Those are not experts in this type of injury and in this type of condition. So what we're catering to is those that want the highest level of professionalism. Those are the doctors that we are catering to. Those are the doctors that we love and want. We look at this study. Would there be any disc herniations in this study? No, everything's within normal limits. So this is the beauty of this. We take this study right here. Could we have, remember, this right here has the highest sensitivity. This has the second highest sensitivity. So if we've got an injury patient, would we want to do a test? First of all, we have ratable levels. These are both grade 3 sprain findings right here. All right, we have severe ligament damage indicated right there. Now, we also have the means to say, hey, we'd like to check out. Let's say the patient's not abating, the symptoms aren't abating, the radicular complaint's not going away, or the radicular complaint's intermittent, and we're being real doctors now. We say, gosh, there could be a disc herniation there. And now we actually have a disc herniation combined with this, which I've told you before, this is the worst injury a patient can have. But what's worse for the patient is when they're treating with doctors that don't even know this injury is there. That's the real dilemma. And that's the dilemma that we're solving. Now, Spinal Kinetics is solving it. We're a diagnostic testing company. We're not an educational company. It's not our job to educate you. We put on webinars to do education, to do very fast educational programs to show you the value of what you get, right? Now, here's what I'm going to tell you. When you do this type of testing yourself, especially in the injury field, you appear small and insignificant, and you make the test results appear the same, right? I have the most experience in the country with this. We have providers that I'm working with that see 400 or 500 injury cases a month, and providers that see 1, and providers that see none, and providers that see 20, and providers that see 15, and providers that see 10, and providers that want to see a lot more, right? But when you do not do outside testing, you appear small. Because you got to remember, the biggest thing in this field right now is that this is William Morris. I've showed this slide in a lot of different programs, and it says right here, it has been estimated the precise diagnosis is unknown in 80 to 90% of low back disabilities, right? He's the top guy in the world on intersegmental pressures. He's the top researcher at the Ohio State Biodynamics Laboratory. He's published over 200 research papers. He's the top in the world at intersegmental pressures. And he says, look, the biggest problem that we have is diagnosis. He also says in his book, this is one of the best books there are to buy and to understand, 85% of low back disabilities do not have a pathoanatomic diagnosis. That means they're working with doctors that don't know what's actually the problem with the patient. And he says most traditional imaging is of minimal benefit. Now, why? Because it's not weight bearing. So what we are doing is we're elevating the profession, whether the profession is medicine, doctors of osteopathy, doctors of chiropractic, doctors of physical therapy, anyone that wants to be increasing their professionalism and understanding of what the patient has, that's what we're doing. Now, when you go outside, when you try to do your own study or you try to send it out to a small little company that's never done them before, it's just starting to get into this because it thinks it can make money doing it or whatnot, it kills your perceived professionalism in depositions. It will kill your abilities to be unbiased in court. It absolutely kills it, and it kills your referrals. And it kills you in the injury community, in your local community. Because as soon as you get killed in deposition with it, as soon as you get killed in court with it, trust me, attorneys talk, the whole environment talks, right? You get killed, your reputation gets killed, and it doesn't have to be that way. It really doesn't have to be that way. At Spinal Kinetics, we're helping to create much better injury and chronic pain doctors. That's what we're doing. That's what we're very proud of. Now, a lot of doctors will say, well, gosh, I really like these programs. I like these webinars, right? And I know that what you just saw, you completely looked at and said, God, that makes sense, but how do I apply it, right? That's why outside of Spinal Kinetics, I'm the director of education of Spinal Kinetics, but I have another company called BioCybernetics, where I have the top online training program for spinal ligament injury specialists called the Smart Injury Doctors Program. This is where I teach, and it's so inexpensive right now. It's like $1,497 to sign on. It's money back guarantee. If you don't like it in the first month, you go away. There's a $97 marketing a month program that basically, if you bring in one injury patient in the whole year, you pay for the whole course. You pay for the whole marketing procedure, right? This is what allows you to understand what makes you unique and then message what makes you unique. And doctors that are in it, first of all, say, wow, they didn't know how much they didn't know until they realized how much they didn't know. Now, I've been a member for 9 months and been seeing a return on my investment almost immediately. Our office started seeing more unrepresented third-party claims settle for full billed amounts. Why are they getting unrepresented claims settling for full billed amounts? Why are they getting paid in full? Documentation, doctors. If you don't have the injuries documented, you're not going to get paid. And the majority of your documentation problems are to get paid. Now, if you think this is a solicitation for this course, it's not. It's just that a lot of doctors will want to know, well, where can I go to get more information on this? This is the program you can do that. Whether you sign up for it or not, I don't care. I'm just saying, oh, I just get asked so much, well, how do I get more information? Or what do I do? Since beginning Dr. Cronk's program, I'm increased by over 1 new PI case per week. That's with his staff. His staff are bringing him in 4 new patients a month or more, right? 52 new injury patients a year because of a staff training program I created to educate the staff and also educate attorneys, right? So when I talk about depositions, I had a great time testifying in court a few weeks back. I spent 12 years getting battered and bruised by the opposing attorneys when I was called an expert witness in auto accident cases. I often was made to feel like a second-class healthcare provider while explaining my care. Utilizing the spinal ligament injury assessment tools I've learned, I simply explained the mechanism of the injuries the patient suffered, gave simple analogies that the jury understood completely, and I had a blast. I can't wait to go to trial again. Those are the kind of testimonials that I love. Now, the other thing is completely outside of spinal kinetics. Myself, I am developing the largest injury platform in the country. You will hear about this injury platform. Everyone in the country will hear about this injury platform. And guess what? It's designed for patients to find doctors that understand what I just showed you, because those are what they need in order to reduce their risk, one, when they're injured, of not being in chronic pain for the rest of their life and a broken piece that nobody can pay enough money to. And two, if they are a broken piece and they are chronic, how to find the doctors that understand what caused their chronicity in the first place. Remember that slide I put up on spinal ligament injuries? So that's what's being created. Now, you will see spinal kinetics in dynamic chiropractic, you will see it in chiroeconomics, and you will see, hey, go download a free report, the 3 biggest with MRI at smartinjuryradiology.com. It goes over a little bit of what I was just presenting today. It doesn't go over this current science that I just showed, but it tells you what the difference is between MRI and X-ray so that you can become an X-ray, a spinal ligament injury expert. Whether you're doing injury work or you're doing chronic pain work, you can become the expert that everyone talks about. Other doctors talk about, attorneys talk about, patients talk about. The doctors where the people in your local area need to go. That's what you can become. And I'm telling you that the more that you apply this information, when I look and I sell this online training program for $1,497, I know that this information is changing careers, that the income that a person can actually achieve significantly changes. Their families change. What they can do with their families changes. So that's why we're so excited about it. That's why we put on these programs. And I try to keep these programs very simple and right to the point. I try to keep them under 30 minutes because I know you're professionals and I know you're very busy. So at this point, what I'm going to do, and I apologize again for my mouse, I'm going to answer any questions that you have. If you have any questions, you just simply type the question into the question box and I will answer your questions. Okay, great. I have an injury patient that I started treating a month and a half ago. Can I still do the testing now? Yeah, of course you can still do the testing now. You want to understand the patient's condition. You want to understand, first of all, if they have a ligament injury and they have no excessive motion, the chances of them having a ligament injury are slim and none, right? So if you're saying they have a ligament injury, you want to know the severity and location of the excessive motion in the spine. And of course, I'm going to promote Spinal Kinetics. We're one of the top. First of all, we're the only national company. The only national company that should like set off some bells. We're the only ones that have published. We're the only ones that have published science. We're the only ones that do programs like this. Everybody today in the market that's trying to do something small or do it themselves logs into our information, logs on to our webinars to see if they can grab bits and pieces of it. But the problem is they're only grabbing bits and pieces of it. So yeah, you definitely at that point would want to send in for it. Good. I've used Spinal Kinetics, and the difficulty I had was getting my attorney to understand the significance of the report. Okay, good. So here's the thing. That comes up a lot, and it only comes up, in my experience, and please don't take this the wrong way, but it only comes up with providers that don't have a lot of experience themselves, right? So it's kind of like, I remember when I first started adjusting a patient. As a matter of fact, the first patient I adjusted, I was sweating, I was nervous, right? So, you know, some of you have done 2 reports, 5 reports, 10 reports. That's like your 10th adjustment, right? You're still not really um, all that experienced with it. So educating an attorney is really, really easy. That this report, I said the 3 biggest pitfalls with MRI and spinal ligament injury diagnosis. You download that. You want to download that because that's something that you can give to an attorney that explains what this testing is and what it can do, as opposed to you trying to explain it at first. So I would highly recommend that every doctor on this call today download that report and read it, right? It seriously sets you apart. So getting lawyers to understand injury testing is just, to the lawyer, do you want to have the injury imaged? So if you're going to have a fracture, do you want me to actually image the fracture or not? Or do you want me to just say it's a fracture? Because if there's a fracture, the lawyer wants an image. He just doesn't understand that inherent in a fracture is a displacement. He doesn't understand that inherent in a sprain is either 1 or 2 things or a combination. Excessive motion in the joint, or in the case of the spine, disc herniation also, right? Shoulder joint doesn't necessarily have a disc, so there's no disc herniation. So it's just that easy. Okay, when the question comes up, where do I go to get the program again? You go to smartinjurydoctors.com, smartinjurydoctors.com. And you want to go out and you want to get that. I've tried to make that program so inexpensive for doctors for what you get, so inexpensive, and it won't always be that way. So you want to go and you want to get that. Okay, so here's so basically what I'm assessing from this webinar today is that you're saying that at C4, C5, and C5, C6, if there's translation in extension, that there's a good chance of disc herniation. Okay, here's the beautiful thing about what I teach, everything that I do. I've said that for a long time, but today what I'm doing is presenting the research that says it. So you don't have to say it. The research says it. If you have a ratable impairment, you don't have to say it. The AMA guide says it. If you have a spinal instability that causes headaches, you don't have to say that this causes headaches. You can just show common symptom list for spinal instability or spinal ligament injury in the cervical sprain, and it'll show that it causes that. If you have a cranial cervical junction ligament injury, you don't have to say anymore, oh wow, the person could have cognitive dysfunction, or they could have migraine headaches, or they could have dizziness, or they could have tinnitus, or they could have problems with pain in their scalp, or even problems when they comb their hair, pain behind their eye. You don't have to say any of that anymore. You just have to show, okay, here's what everybody knows when you have this injury, that these are the symptoms that the person has. So remember, diagnosis is to work the symptoms back to the most simple cause, the physical cause. So we are working with doctors that are getting back to not just treating symptoms. They're treating the cause of the problem, and they're identifying the cause. And that's the beauty of this, of our service, and that's the beauty of what we do. For doctors that are new, I always suggest start in the injury space. Start with your injury work first. Now, one last thing I'm going to say, and that is that when you sign up, so if you're not used Spinal Kinetics, you want to go to 877-508-9729, and you want to sign up. You want to sign up with us, or go to thespinalkinetics.com and put in a request for us to call you, and we'll call you. 2 things have to occur when you use Spinal Kinetics. 1, you have to have good images, right? And 2, you have to fill out 3 pieces of paperwork accurately to send in with the study. That's all we request from doctors. Good images, and just be compliant with filling out the paperwork that we need to process your study quickly. And if you don't understand how to, we have videos on how to fill out the information or how to fill out the forms. But if your office is one of those offices that doesn't seem to be able to get that, then we call you and we correct you. But we don't want to call you 2, 3, 4, 5 different times, 10 times to correct you on paperwork. We feel that as professionals, yeah, we'll call you once or twice to help you out, but then we want you to actually get the fact of what's happening. Because what happens when your paperwork is not complete, you go off to the side and we get to you when we get to you. Because we're working with the doctors that don't have that, we're getting them their studies out right away. Okay, I don't see any other questions. Hopefully this was stimulating enough that it created some questions. But as I said, I don't like to keep doctors. I know you're busy. And so these programs are short and to the point. And we have them twice a month. We have different topics and they're recorded, and there'll be a recording that comes out to you that you can view them in. So doctors, I thank you very much for your time today. I look forward to working with you. I hope this gave you some insight into what I think is one of the best scientific breakthroughs. And it's not really a breakthrough, it's more of a scientific validation of what we already knew. One of the best scientific validations for spinal ligament injury specialists in the market today. So doctors, thank you very much for your time. I appreciate it. You have a good rest of the day.